What if the reason that mucus keeps coming back to your throat, no matter what you do, no matter how many times you clear it or how many warm drinks you have, has nothing to do with the mucus itself? What if the approach most people take, the throat clearing, the honey drinks, the lozenges, the warm teas, is deceptively simple in the wrong direction, aimed at the surface while the actual cause sits untouched underneath, doing the same thing night after night, completely unaware it is being ignored? Because here's what the research and clinical evidence have been quietly confirming for years. The kind of thing a small group of ENT specialists and gastroenterologists have understood for a long time, while most general advice has never caught up. Persistent throat mucus in older adults almost always has a specific, identifiable, addressable root cause. And the reason it keeps coming back is not your age. It is that no one has ever addressed that root. Stay with me, because what I am going to walk you through in the next several minutes has genuinely changed how most of my patients think about this problem. And more importantly, what they do about it. My name is Dr. Weston, and in 15 years of clinical practice, I have worked with hundreds of patients who had been living with persistent throat mucus for months, sometimes years, trying everything they could find, and still waking up every morning with that thick, uncomfortable feeling that nothing ever seemed to clear. I have sat across from people who told me they had tried every remedy they knew: honey and lemon every morning, steam inhalation, pharmacy preparations. Some of them had been told by more than one person that this was simply part of getting older, and they would need to learn to manage it. And I have spent more time than I can count asking myself, for the patients who waited years before finding the right answer, what could they have done differently, earlier, if they had just had the right information sooner? That question is what drives this channel, and it is what today is about. Before I go any further, I want you to drop a comment right now and tell me honestly, how long have you been dealing with this? Just a rough number. And if you have ever been told it is simply your age and you should accept it, please add the word dismissed to your comment. I read every single one, and today your answer genuinely matters. Now, before your mind goes straight to fixes, and I promise we are getting there, I need you to stay with one idea for just a moment. Because if you skip this part, the rest of it will not land the way it should. The problem is never the mucus itself. I know that sounds like a detour, but hear me out, because this is exactly where most people's understanding goes wrong, and why everything they try keeps failing. Mucus is one of your body's most sophisticated defense systems. It traps dust, bacteria, viruses, and airborne particles before they can reach deeper into your airways and lungs. It keeps the delicate lining of your respiratory passages protected. It is working for you, silently and continuously, and you do not want to stop it. That is not the goal. The goal is to understand why that normally fluid, manageable layer is becoming thick, sticky, and impossible to clear. Why instead of flowing through your system quietly, it is stagnating in your throat and forcing you to clear it dozens of times a day. And here is the part that most explanations skip entirely. After the age of 60, your body's natural ability to manage and clear mucus becomes gradually less efficient. The tiny hair-like structures that line your airways and sweep mucus upwards slow down. The lymphatic system, which drains excess fluid and prevents congestion in the tissues, operates at a reduced capacity compared to earlier decades. Irritants that might have caused a brief, barely noticeable mucus response at 40 can cause a persistent, genuinely bothersome response at 65 or 70. This means that when there is an underlying cause driving excess mucus production, your body at this stage of life simply cannot clear it the way it once could. Understanding that context matters before we talk about solutions, because it explains why the causes I am about to describe have such a pronounced effect in older adults specifically. And it explains why managing the symptom, which is all any remedy does, is never enough. You have to go after the root. I want to tell you about a patient of mine, a wonderfully determined 68-year-old woman named Evelyn, who came to see me after 8 months of dealing with what she described as a throat that never felt clear. Evelyn had tried everything: honey and lemon drinks every single morning, steam inhalation before bed, various preparations from the pharmacy. She had seen 2 different people who told her it was the kind of thing that happens as you get older, and that she would need to learn to manage it. When Evelyn and I sat down and went through her full picture, what emerged was not one cause, but 3 overlapping factors, none of which had ever been properly identified or addressed. 3 weeks after we tackled those factors with a targeted, practical approach, Evelyn messaged me to say that for the first time in months, she had woken up 2 mornings in a row without that feeling in her throat. No prescription treatment, no complicated protocol, the right information and the right steps applied to the actual cause. That is exactly what today is about. And I want to start with the cause that consistently surprises people the most. Not because it is rare, it is actually responsible for a very significant proportion of persistent throat mucus cases in older adults. But because it produces almost no symptoms that people think to connect to their throat, most people miss it completely, and it has almost certainly never come up in any conversation about your throat. Most people have heard of acid reflux, that burning sensation in the chest after a heavy meal or a strong coffee. That is the familiar version. But what I am describing is something different, and the difference is exactly what makes it so consistently overlooked. Stomach acid can travel upward not just into the lower esophagus, but all the way up to the throat, the voice box, and sometimes even higher. And because the throat and vocal cords are far more sensitive to acid than the esophagus is, even tiny amounts of acid reaching those areas cause significant irritation and inflammation. Here's the part that makes it so easy to miss. There is often no heartburn, no burning in the chest, no obvious digestive discomfort at all. Just a persistent need to clear the throat, particularly in the morning. A slight roughness or change in the voice. Sometimes the sensation of something being caught in the throat that never quite resolves. And of course that mucus that keeps coming back no matter what you do. What is actually happening is that your throat, reacting to the microscopic irritation from acid contact, is producing extra mucus as a protective response. Your body is trying to coat and protect the irritated tissue. That is a completely logical and appropriate biological response. But when the underlying acid exposure keeps happening night after night, the mucus production keeps being triggered over and over. And no honey drink, no lozenge, no throat spray addresses that, because none of them address the acid reaching your throat while you sleep. The practical approach begins with two changes that are simple, but genuinely effective. The first is to stop eating within 3 hours of going to bed. When your stomach is still actively digesting and you lie down, the physical position alone makes it considerably easier for stomach contents to travel upward. 3 hours of upright digestion time before lying down makes a meaningful difference. The second is to elevate the head of your bed, and I want to be specific here because most people do this incorrectly. Adding an extra pillow does not work because it bends your neck, rather than inclining your whole body. What you want is a small wooden wedge placed under the legs of the headboard, raising the head end of the bed by several centimeters. That gentle, consistent incline uses gravity to keep stomach contents where they belong overnight. If you take anti-inflammatory medication regularly for joint pain or arthritis, please raise this specifically with your doctor in relation to your throat symptoms. Certain commonly used anti-inflammatory medications can relax the muscular valve that separates the stomach from the esophagus, making it easier for stomach contents to travel upward. The connection is real, it is medically recognized, and it is worth discussing. But it does not stop there. Because there is a second cause that operates quietly in the background for most of the people it affects. And the reason it almost always goes unaddressed is that it does not look like what people expect it to look like. Most people associate sinus congestion with blocked breathing you can feel, or pressure across the face and forehead, or a nose that will not stop running. But chronic, low-level sinus inflammation does not have to produce any of those dramatic symptoms. In many older adults, it simply produces a steady, quiet draining of mucus down the back of the throat, particularly when lying down at night and during the early morning hours after rising. You go to bed, and while you sleep, mildly inflamed sinuses drain slowly downward by gravity into the back of your throat. You wake up with that thick, uncomfortable feeling and the immediate need to clear your throat before you can do anything else. You experience it as a throat problem. It is actually a nasal one. Many people experiencing this have been buying antihistamine tablets from the pharmacy for months, assuming they have ongoing seasonal allergies. But those medications dry out the mucus temporarily without addressing the underlying inflammation. And dried, thickened mucus that is harder to move is often more uncomfortable than the original problem. You have treated the surface, and the underlying cause is still running. The most effective approach for this cause is regular nasal rinsing with a gentle, warm saline solution. A simple mixture of warm, previously boiled water with a small amount of plain salt used to flush each nostril gently once or twice daily. This washes away the inflammatory irritants and allergens that are driving the congestion, reduces the postnasal drip at its source, and keeps the mucus thin enough to be cleared naturally. It sounds remarkably simple. It is. But the consistency with which it produces real improvement genuinely surprises most patients who apply it. One specific detail matters here. Always use water that has been boiled and cooled, not straight tap water, which in many areas contains trace microorganisms that are harmless when swallowed, but should not be introduced directly into the nasal passages. And add a small pinch of bicarbonate of soda alongside the salt. Bicarbonate neutralizes acidity in the nasal passages and supports the thinning of mucus more effectively than salt alone. Tell me in the comments right now, have you ever tried nasal rinsing? And if you have, did it make a difference? I want to know because your experience might encourage someone watching this to try something they have been hesitant about. Now here is what I tell almost every patient who has been dealing with this for more than a few months. And it is the piece I cannot leave out because for some of you, it will be the most important thing you hear today. What you are taking every morning may be the reason your throat cannot clear itself, no matter what else you do. Certain medications that many older adults take regularly can contribute directly to persistent throat mucus, either by promoting the kind of silent acid reflux I described a moment ago, by drying the mucus and making it thicker and stickier, or by triggering a reflex that increases mucus production as a documented, recognized side effect. One specific category worth knowing about is medications commonly used for blood pressure management. Some people taking medications in this category develop a persistent dry throat clearing sensation and increased mucus production as a side effect. The mechanism involves a naturally occurring substance in the body that these medications allow to accumulate, and that substance, in some people, triggers an irritation response in the throat. If you take blood pressure medication and your persistent throat mucus began or noticeably worsened around the time you started that medication, this connection is absolutely worth raising with your prescribing doctor. There may be alternative medications in a different category that manage your blood pressure just as effectively, without this particular side effect. I want to be completely clear. Please never stop or change any prescribed medication on your own. Always have this conversation with your doctor first. What I am saying is that this connection is real, it is medically recognized, and your doctor can only help you if you raise it directly. And there is one more piece I cannot leave out, because it compounds everything I have just described, and for many people, it is the reason that even when they begin addressing the root causes, progress is slower than it should be. Tobacco smoke, whether from your own smoking or from regular passive exposure, damages the tiny hair-like structures in your airways responsible for sweeping mucus upward and clearing it naturally. Even if you stopped smoking years ago, the recovery of these structures is gradual. Other irritants, wood smoke, strong cleaning product fumes, heavy traffic pollution, dry, heated, or air-conditioned indoor air, all create ongoing low-level irritation that continuously triggers mucus production as a protective response. And then dehydration compounds all of it significantly. When your body is not adequately hydrated, the mucus it produces becomes noticeably thicker and stickier. Think of honey straight from the jar on a cold day versus the same honey gently warmed. The composition is identical, but the consistency changes entirely. Your mucus behaves in exactly the same way. Well-hydrated mucus is fluid and clears naturally. Dehydrated mucus is thick, sticky, and accumulates in the throat rather than being cleared efficiently. And here's the specific point that matters for older adults. The thirst mechanism becomes less reliable and less sensitive as we age. You can be meaningfully dehydrated and feel no particular thirst. If you are waiting for thirst to prompt you to drink, you may consistently be operating in a state of mild dehydration without realizing it. Start every morning with 1 or 2 glasses of plain warm water before anything else, before coffee, before breakfast, before your morning medications. Warm water first thing activates the digestive system, begins the rehydration process after the overnight fast, and immediately begins to thin and loosen the mucus that has accumulated in the throat overnight. This single habit costs nothing and produces one of the most noticeable improvements people report for morning throat clearing. Now I want to pause and address something directly because I know what some of you may be thinking. You may be thinking that you have already tried warm drinks, that you have already tried honey, that you have done these things and the mucus still keeps coming back. And to that I want to say, you are right that those things did not work. But here is what is different about what I have described today. Warm honey drinks soothe the surface of the throat. They calm irritated tissue temporarily. They produce that hour of relief you have probably already experienced, and then the feeling comes back, because nothing underneath it has changed. They do not address acid reaching your throat from below while you sleep. They do not reduce the sinus inflammation, producing a steady drain of mucus down the back of your airway. They do not change the effect a medication is having on your body's chemistry. When you clear your throat, you are managing a symptom. When you elevate the head of your bed, you are removing a cause. That is the difference between doing something and doing it correctly. That is the difference between an hour of relief and stopping it from coming back for good. Let me bring this together into a clear picture of what you can actually do starting today. Tonight, eat your last meal at least 3 hours before going to bed. Raise the head of your bed with a wedge under the headboard legs, not an extra pillow. Drink a full glass of warm water before you sleep. Tomorrow morning, begin your day with 1 or 2 glasses of plain warm water before anything else. Before coffee, before breakfast, before anything. This week, purchase a simple nasal rinsing device from your pharmacy and begin daily warm saline rinsing morning and evening. Make an appointment with your doctor to go through your current medication list, specifically in relation to your throat symptoms, and ask directly about any medications known to affect mucus production or acid reaching the throat overnight. And commit to consistent hydration throughout the day rather than waiting for thirst. Evelyn did not need a prescription. She needed someone to look at the full picture, identify the actual causes, and give her the practical steps to address them at the root. She woke up 2 mornings in a row without that feeling for the first time in 8 months, and she did it without a single new medication, without a complicated protocol, and without accepting that this was simply what getting older felt like. Now you have that same information, the same framework she used. Your throat has been telling you something for a long time. That persistent mucus is not an unavoidable part of getting older. It is a signal, a specific, addressable signal from a body that is trying to protect itself from something that has not been identified yet. And identifying it, which is what you have just done, is where the path to actually clearing it begins. Your age is not a sentence. If this gave you something genuinely useful today, please hit the like button right now. It helps this channel reach more people who have been dealing with the same thing and been told to simply accept it. Subscribe if you have not already, because I release new videos every week covering exactly these kinds of health conversations that deserve more time and more honesty than a 15-minute appointment allows. And if you know someone who has been living with persistent throat clearing and been dismissed, please share this video with them. The right information at the right time makes a real difference. I will see you in the next one.